Hi, I'm Dr. Vickers. I'm a triple board certified dermatologist and Mohs surgeon, and today I'm going to answer your most Googled questions about skin cancer. Hopefully we can learn something. What causes skin cancer? Great place to start. So there's many things that cause skin cancer or sort of contribute to the formation of skin cancer. They all have a common denominator. There are cells that start to have abnormal DNA that causes them to divide and grow in an uncontrolled way. So within your skin, you have cells that are constantly dying and falling off and need to be replaced. And you have some cells that are going to divide and grow to replace them. And normally this is done with many checks and balances to ensure that this is a good time to divide and replace cells as needed. And the machinery to do all of this is controlled by DNA. Mutations to this DNA from many different sources, such as UV light, can lead to this sort of perfect storm where there is an abnormal machinery that drives the cell to divide in an uncontrolled way. And as long as these cells with the mutated DNA exist, they will just continue to grow to the point where they start to destroy the normal function of all the cells around them. That's how they can cause harm to the body. What does skin cancer look like? Another good question, and it's not an easy question to answer because it really depends, and it depends on the type of skin cancer. So it's actually very difficult to try and give you some clear guidelines on what exactly it looks like and when to worry. But if we think about what skin cancer is fundamentally, we can shed a little light on it and have some idea of what's a concerning spot and what's not. Okay. The trickiest part about this is, as we discussed, skin cancer is abnormally growing cells, but all abnormally growing cells are not cancerous. Cells are constantly picking up mutations that cause abnormal growth of cells, but most of them are either stopped by the immune system or grow just a little bit and then reach another failsafe that keeps them in check and keeps them in an equilibrium where they don't continue to grow in an uncontrolled way. And so it's an immensely difficult task to try and figure out with certainty which of these groups of cells are dangerous and which ones are not. So from what the human eye can see, there's a few things that I tell all my patients to look out for. So spots that are growing very fast, spots that are changing very quickly, either in their color or texture or something like that. Maybe the most telling would be a spot that has been bleeding and just won't heal even though it's been several weeks. And if we think about it, this is because these abnormal cells, as they're growing in an uncontrolled way, don't take the time to form the normal connections with their neighbors and their nutrient supplies. And so they will continue to grow and they'll also die off very quickly, which leads to a sore or a spot that's going to bleed, and the normal cells can't get in there to repair the wound because it's just continuing to divide. Those are things to look out for to have somebody take a closer look at it, but unfortunately there are forms of skin cancer that break all of those rules, and there are benign things that can match those descriptions. So it's something that you have to talk about with a professional. The best method we have with today's technology for predicting how a group of cells is going to behave is how they look under the microscope. And so as these cells' DNA mutates and they start to grow in an abnormal way, these cells start to appear differently under the microscope. What skin cancer is most common? So we categorize and name types of skin cancer based on either the cells that make them up or what normal structures they resemble underneath the microscope. So basal cell carcinoma, the cells that make it up resemble the basal layer of the epidermis. And likewise, squamous cell carcinoma is named because it's made up of cells that look like the squamous cells that are in your epidermis. Melanoma is made up of melanocytes that have picked up mutations. Melanocytes are the cells that normally create pigments and give your skin color. So basal cell carcinoma is by far the most common type of skin cancer. So what skin cancer is most dangerous? So in general, the more common the skin cancer, typically the less aggressively it behaves and therefore the less dangerous that it is. But when thinking about risk of different types of skin cancer, it's important to note that it's often a lot less about the type of skin cancer, and it can be much more important what stage that skin cancer is. So how far advanced is it and how long has it been growing? Squamous cell carcinoma and melanoma can be very, very dangerous when they are advanced and if they've started to break off and spread throughout the body. But if they're caught very early and they're small, they can be treated with relative ease. And so how far advanced it is a more important factor. How is skin cancer treated? Well, in theory, it's actually quite simple. If we have cells with some bad DNA, we simply have to destroy or remove those cells, and then the cancer will stop spreading. And because skin cancer is relatively easy to get to, if we can, we typically try to cut out and remove the skin cancer that way. The nuance around the different types of treatments and strategies comes from wanting to make sure that you get all of those abnormal cells out, because if you do leave some cells with that abnormal DNA behind, they can come back and continue to divide, and the cancer will recur. So the exact treatment that your dermatologist will recommend and perform for you will depend on many different factors, including the type of skin cancer, the location, how deep we think it is, and it can range from simply scraping the cells to using chemotherapy creams to using some radiation to simply cutting around it or doing something like Mohs surgery, which is where you cut out the skin cancer and check it in the lab in real time to make sure that all of those abnormal cells are out. Okay. All right. Well, that's all that I have time for. But if there's more questions that I missed, please let me know, and I'd be happy to do more videos like this.